Hi everyone, this is Dr. Jiaxin Shen from Hematology Department from Shantou University Medical College. Having talked about the erythrocytes in the last session, this time we will move on to leukocytes. You will encounter several new terms in this session. Your learning objectives are to name 5 kinds of leukocytes, to explain each of their clinical features, to trace the cells back to where they are produced, and to predict how leukocyte disorders evolve. Indeed, a bunch of difficult new terms this time, but please be patient since they are all crucial to help us fight against diseases. Given to this powerful defensive ability, let's see this case. A 16-year-old male student complained about a 3-day fever of 39 degrees centigrade, coughing with yellow sputum and dizziness. It sounds like your patient probably had an infection. So the questions are, would you expect to see an elevated count in white blood cells to be closest to 5,000, 10,000, or 15,000 per milliliters? What if 180,000 per milliliters? What are these conditions called? White blood cells, also called leukocytes, are warriors in our body. Normally, 5 types of white blood cells are in the circulating blood. They differ in size, nature of their cytoplasm, shape of the nucleus, and staining characteristics, and they are named according to these traits. For example, leukocytes with granular cytoplasms are called granulocytes, whereas those without cytoplasmic granules are called agranulocytes. A typical granulocyte is about twice the size of a red blood cell. Members of this group include neutrophils, eosinophils, and basophils. Neutrophils are the first to act when there is an infection and are also the most abundant leukocytes. Neutrophils fight bacteria and viruses by phagocytosis, which means they engulf pathogens that may cause infection. Eosinophils attack parasitic worms, and their numbers increase during allergic reactions. Basophils also work in allergic reactions. They enter the injured tissues by the release of histamine. The agranulocytic group has crucial roles in immunity. They include lymphocytes and monocytes. Lymphocytes are the immune cells that help with our immune response. There are 2 types of lymphocytes, the B cell and T cell. B lymphocytes produce antibodies that find and mark pathogens for destruction. T lymphocytes kill anything that they deem abnormal to the body. And monocytes, the biggest white blood cells, that are responsible for rallying the cells to defend the body. Monocytes carry out phagocytosis and are also called macrophages. This huge flowchart shows the formation process of leukocytes, giving us a second perspective to see these 5 different cells. It turns out that all these blood cells develop from one common precursor in the red bone marrow in response to hormones. The cell that gives rise to all of these cells is called a pluripotent cell, which comes from Latin, meaning sort of able to do anything. It gives rise to 2 different lineages, the myeloid lineage and the lymphoid lineage. We already know that myeloid lineage gives rise to erythrocytes and platelets. It also gives rise to 3 leukocytes, neutrophils, the most common in the blood, and eosinophils and basophils. Macrophage, or its early form called monocytes, comes from this myeloid lineage as well, while there are 3 important cells coming from the lymphoid lineage. 2 of them are B and T lymphocytes. It makes sense they come from the lymphoid lineage. The natural killer cell also comes from this lineage. You will learn more of it from the immune system. Analysis to differential white blood cells may facilitate clinical doctors to make diagnoses in particular diseases. The number of leukocytes in a microliter of human blood, called the white blood cell count, normally is 3,500 to 10,500 cells. White blood cells counts are of clinical interest because their number may change in response to abnormal conditions. A total white blood cell count below 3,500 per microliter of blood is called leukopenia. Such a deficiency may be seen in viral infections such as influenza, chickenpox, or AIDS. But a total number of white blood cells exceeding 10,500 per microliter of blood constitutes leukocytosis, indicating acute infections most often caused by bacteria. According to the symptoms and signs at the starting case, the patient most likely has an infection. You may expect elevated leukocytes since white blood cells are able to slip out of the capillary blood vessels, and the circulation system is simply their means of transport to areas of the body where they mount inflammatory or immune responses. Whenever white blood cells are mobilized for action, the body speeds up their production and their numbers may double within a few hours. This elevated condition is a normal homeostatic response to an infection in the body. But what if the white cell count is 180,000 per milliliters? If the number is incredibly high like this, you would change your mind into considering leukemia, a cancer of the blood or bone marrow characterized by an abnormal proliferation of blood cells. In this case, the incredibly high level of white blood cells is malignant and may be weakened or dysfunctional in fighting pathogens, putting the patient at the risk of developing infections. Even worse, the patient's red bone marrow is churning out many abnormal white blood cells, which are crowding out the production of normal bone marrow elements. Therefore, besides infections, the lack of platelets fails to stop bleeding, and the lack of erythrocytes results in anemia. So, to sum up this session, we study leukocytes from two different angles. One is based on its staining features under a microscope. The other angle targets in its formation process from the hematopoietic stem cell. An improper numbers of WBC count indicates special pathological conditions which needs clinical considerations of the patient as a whole to make an accurate diagnosis. That's all for today. Let's take a rest. Thank you.